Urinary incontinence can have various causes and risk factors that contribute to its development. Here are some common causes and risk factors associated with urinary incontinence. 1. Weak pelvic floor muscles. Weakness or damage to the pelvic floor muscles, which support the bladder and control urination, can lead to urinary incontinence. 2. Overactive bladder muscles. Overactive bladder muscles can cause a sudden and strong urge to urinate, leading to urinary incontinence. This condition is known as urge incontinence. 3. Hormonal changes. Hormonal fluctuations, especially in women during pregnancy, childbirth, and menopause, can affect bladder control and contribute to urinary incontinence. 4. Prostate issues. In men, urinary incontinence can be linked to prostate problems, such as an enlarged prostate, benign prostatic hyperplasia, or prostate cancer, which can obstruct the urinary flow. 5. Neurological conditions. Certain neurological disorders, including multiple sclerosis, Parkinson's disease, stroke, and spinal cord injuries, can disrupt the nerve signals that control bladder function, leading to urinary incontinence. 6. Urinary tract infections, UTIs. Infections of the urinary tract, such as bladder or urethral infections, can cause temporary urinary incontinence. 7. Medications. Certain medications, such as diuretics, sedatives, muscle relaxants, and medications that affect bladder control, can contribute to urinary incontinence as a side effect. 8. Chronic coughing. Conditions like chronic coughing or respiratory problems can put pressure on the bladder and lead to stress incontinence, where leakage occurs during physical activities or coughing. B. Risk factors. 1. Age. The risk of developing urinary incontinence increases with age, as the muscles and tissues involved in bladder control may weaken over time. Women are more prone to urinary incontinence due to factors like pregnancy, childbirth, and menopause, which can affect the pelvic floor muscles and hormonal balance. 3. Obesity. Excess weight and obesity can put additional pressure on the bladder and pelvic organs, increasing the risk of urinary incontinence. 4. Family history. There may be a genetic component to urinary incontinence, as some studies suggest a higher likelihood of developing the condition if a close family member has experienced it. 5. Smoking. Smoking can irritate the bladder and contribute to chronic coughing, which can further increase the risk of urinary incontinence. 6. Chronic conditions. Chronic conditions like diabetes, chronic obstructive pulmonary disease, COPD, and certain neurological disorders can raise the risk of developing urinary incontinence. 7. High-impact activities. Engaging in high-impact exercises or activities that put a strain on the pelvic floor muscles can increase the risk of urinary incontinence, especially in individuals with weak pelvic floor muscles. It's important to remember that the causes and risk factors can vary for each individual, and it's advisable to consult with a healthcare professional for an accurate assessment and personalized treatment approach if you are experiencing urinary incontinence.